Hello students, welcome to second part of the lecture Introduction to Anatomy. So I am Dr. Deba. Let's have a quick look at the different terms we had discussed previously. So students, we had discussed about the terms anterior, posterior, superior, inferior, medial and lateral. So these are few terms of the which are used in case of describing the human body. So if I say anterior, it means something is in front. Posterior, in back. Superior, towards head or the cranium. Inferior, towards leg or caudal is the towards leg or caudal. Medial, towards the midline, and lateral, away from the midline. All right. So these few terms you need to be acquainted with. Now, here's a quick revision. Students, see what type of movement is being done here. So as you can see, this is the axis of the bone and rotation is taking place inwards on the axis. So it is an example of internal rotation. Similarly, you can see here in this image, the forearm has been rotated outside or externally from the midline. So it is the external rotation. Now students, can you identify this movement? Well, you can see this side, you have the medial end of the or the medial border of your foot, and this side you have the lateral border. How you identify the medial border? See, the big toe is on the medial end. So here you can see the foot is being rotated inwards, whereas here the foot is being rotated outwards. So this movement here is the inversion, whereas this movement outwards is known as eversion. All right. So inversion and eversion. So I hope the memory is refreshed now. Also, there were a large number of other terms, relative terms. So we had learned them. Coming to a few more terms now. So students, the skeleton, as you know, it has 206 bones, and these 206 bones, they have been arranged into two different parts, the axial and the appendicular. So axial skeleton is the part having the head, neck and the trunk, whereas the appendicular skeleton is the skeleton of the limbs. All right. So axial, appendicular. Now students, identify this image. So it is image of the inferior surface of the skull. Now this inferior surface of the skull is also known as the base of the skull. Now students, in case of hollow organs means your stomach, intestine, all the tubular organs, these are hollow. So there are certain terms which are used for the hollow organs. Now if I consider this is a cross section of a hollow organ, let's say intestine. So anything towards the center is known as the interior. Anything towards the periphery is the exterior. And in case if something protrudes inside, so you can see this is the normal organ and something is protruding inside. So if something is protruding inside, it is known as the invagination. Whereas if the same organ has a protrusion outside, if the protrusion is outside like this, then it is known as the evagination. So here are two new terms: the invagination and the evagination. Now coming to the terms of laterality. So student, look at this human skeleton. Now just imagine the different organs which are present within. You know the lungs are present in the thoracic cage and they are present on both sides. So such a structure which is present on both sides of our body, it is known as the bilateral structure or bilateral organ. Similarly, we have a structure or organ known as the spleen. It is present on the left side along the ninth, 10th and the 11th ribs. This structure is present only on the left side. So it is present only on one side. It is known as unilateral. Then coming to few other terms, students, we have a pair of kidneys in the lower abdomen. So if I compare the right lung with the right kidney, so both these structures they are present on the same side of the body. So structures which are present on same side of body, they are known as ipsilateral. Whereas if I compare the right lung with the left kidney, so they are organs which are present on the opposite sides of the body. So if the organs are present on opposite sides, then it is known as the contralateral. Alright, students. So the different terms are unilateral if the organ is present on one side, bilateral if it is present on both the sides, ipsilateral if two organs on the same side are being described, and contralateral if two organs present on different sides of the body are being described. Now moving to the terms for describing muscle. Students, you can see here this is an image of the upper limb. The bone you can identify here, it is the humerus. Here you have the elbow joint, and in the forearm you have the radius and ulna. You can see a muscle. You can see a muscle coming from the humerus and getting attached onto the ulna. So students, this thick portion or bulk of the muscle, it is known as the belly of the muscle or the muscle belly. The part where the attachment is there, this thin strong part, this is the tendon. So always remember muscles attached to bones via tendons and bone to bone attachment is via the ligaments. Now students, in case of contraction of the muscle, there will be a movement like this. This movement which is known as flexion. You can see the forearm moving up. So the end of the muscle which is relatively fixed, if you can see, this end is relatively fixed, whereas maximum movement is occurring at this region. So the fixed end is known as the origin and the moving end it is known as the insertion. However, students, nowadays these terms they are not used. Only we use the terms proximal attachment and the distal attachment. Now here are three other terms which are also very important. I told you already about the tendon, that is the muscle is attached to a bone via a tendon. Now what is aponeurosis? Student, when the attachment of a muscle is on a smaller region, it attaches to a tendon. But in case of large muscles which are flat, like the muscles in our abdomen, muscles of our back, these flat muscles, they have a wide region of insertion. So this wide area of insertion or flattened, flattened sheet-like insertion is known as the aponeurosis. And finally, raphe. What does raphe mean? Raphe means a structure present in the midline which connects two opposite structures.